I think the biggest trend is that people are having babies at a later age. I tell everyone there are three things that are certain in life. There's death, there's taxes, and there's decline in ovarian function. It is certain that our ovaries are going to fail. First thing that anyone should do when they stop contraception, or even before they stop contraception, is take a prenatal vitamin.
I did the pull-out method because birth control bothered me. And anyone that's young, it's not always the best. So many people were like, you're insane.
Interestingly, about 80% of couples will be pregnant within 6 months of trying, and then 90% of couples will be pregnant within a year.
I want to have a baby by this age. So many people plan. But what can you say to someone that's like, I want to start doing it?
I think the first thing that
What's the latest trend? 1 minute you're taping your mouth shut. The next you're supposed to sip a nightly glass of wine or swear it off. Egg yolks are the heroes, then they're the villains. Peptides, weighted vest, creatine for women, the noise never ends. So how do we know what actually works? I am Juliet Hahn, and this is Don't Die Curious. In every episode, I sit down with doctors, innovators, and everyday legends to separate the facts from the hype and uncover what really sharpens the mind, strengthens the body, and fuels the spirit. Stay curious. One good question can change your life forever. Welcome back to Don't Die Curious. I am Juliet Hahn, and I have a very special guest with a really fun story how we met. This is Dr. Eve Feinberg. How are you?
I'm great. Good morning. How are you?
I'm good. So I want to preface how we met because it was really fun. I think it's now 2 years ago.
Yes.
It's not 3 years ago. Okay, I think it's 2 years ago. At Sundance, our husbands. So there was like a multiple people that were like, you guys got to meet. One, because of menopause and perimenopause. And so I was like, oh, I love this. I like could talk about that all day. And then the other was, you have a podcast that you were like, oh no, it's really not that big of a deal. And your husband was like, I think it's actually like a really big deal. You're like, yeah, but it's like very specific. And I was like, well, no, I want to know more about this. And so then we really had fun and I mean, really connected. And I've been wanting to get you on a podcast. We've recorded a couple different snippets things, but now that Don't Die Curious is in season 1 and it's live, and I've talked about so many different things on this podcast, from regenerative farming to hormones to what's good for a woman's body, people walking around these weight vests and all these different trends. And I was like, you know what, Dr. Feinberg, Eve would be so great to talk about fertility. So if you can give us your title, because I'm not going to do that. I know you're at Northwestern, but I know that I like butchered the title before. And I know the fertility word, the other words get me stumped. So if you can just give your title, and then we'll jump into what I want to talk about today.
Thank you. It was great meeting you. And I sit here just smiling at how we met. I'm a full professor of obstetrics and gynecology at Northwestern University. And I also serve as the REI, or Reproductive Endocrinology and Infertility Program Director. So I train the next generation of reproductive endocrinologists.
I love that. And now tell us what your podcast, and is it still in full swing? Because I know 2 years ago it was like I think I even told you what microphone to get, because you're like, well, it's just a bunch of us like kind of geeking out. And I was like, well, no, I want to learn about this, because this was like in the beginning of when I was starting my whole, world into biotech.
Yes, the microphone I'm using now is actually the one that you recommended. The podcast is called Fertility and Sterility on Air. It is very much in full swing, and I will say gaining a lot of speed. And it's funny because sometimes when I'm at professional society meetings, I'll just be talking with a colleague, and someone will dart across the room and say, I heard your voice and I hear you on my morning commute all the time.
I love that. That's one of the things I love about podcasting. And it's so funny because there's so many podcasts out there. And I always tell people, I obviously started my podcast in 2018 when podcasting was still very popular. I mean, it was, but it has even gotten more popular. But there's an audience for everything. And if you're putting good content out and putting good, that's why this curiosity, like whole world, I'm like the most curious person since I was little. My parents are always like, oh my God, you asked so many questions. I still do. I love when my kids ask questions. I love when people ask questions, but there's a place for so many different things. And I think when your husband said, he's like, yeah, don't you like really trend in a lot of different countries? And you're like, yeah, but it's, we're just really talking about the geeky stuff. But so tell us a little bit about what you talk on the podcast about and why it's, of interest for people nowadays.
So the the podcast follows the monthly journal Fertility and Sterility, which is probably the most, I would say it's the most preeminent journal in the space of reproductive medicine. It's been around for 75 years. We're celebrating our 75th anniversary of the journal. And I have worked on the inside track of the journal for a very long time, starting as an associate editor and then rising now to my current role as editorial editor. So the podcast is 4 of the higher level editors at the journal, including our fearless editor-in-chief, Kurt Barnhart. And every month we get together, we review the top papers from the journal. We really dive into the science. We totally geek out on the statistical analyses. We also use it as an opportunity to train fellows, to train people in the field, to train patients to really understand how do we arrive at how we practice? Like, what is the data behind what we do? How do we interpret the statistical methodology? And what differences do we find are significant? And what does that mean? And how does it change our practice?
I love that. And so what I wanted to do, because I love all things holistic, but then I also know that for traditional medicine, there's a space for it. So I think when you and I talked, it was like so many, interesting things. Like I still take a lot of vitamins and I'm not even doing hormone replacement yet because I don't feel like I need it. But the more I learn, I'm like, okay, I will explore it because I do see the benefits of certain things, right? But I love talking to people on both sides because the thing that I'm curious about is taking things on both sides and putting it together in my own head to feel what's best for me. So I love getting the traditional and then then sometimes even the woohoo, like some of the vitamins I take, I'm like, it makes me feel better. Like I took it for, a month and I stopped having this. And it's like, if it's working, it's working. And if I can, keep it, hormones and like the pill and all that stuff really bothered me. I was like that 1% that got all those weird like symptoms. So I was like, okay, I know that I have to be really careful because weird things happen to my body and I'm in such a great space in my life right now. Do I want to play with that? And if these vitamins are working, I'm going to stay with the vitamins, but I love to educate the listeners and also educate myself on certain things. I obviously am well, I know I still could have a baby if I wanted. I'm just going to say that. I'm going to put that
I can help you.
Right. If I wanted, I'm past that. But I think for the listeners, it's really important, especially that we're in season 1. I want to give people such broad thought processes and let them be able to take their own knowledge because knowledge is power. So can you take us through right now what you're seeing, like the trends in the fertility, reproductive space in your world?
So I think the biggest trend is that people are having babies at a later age. And so it's really important to understand. And I tell everyone there are 3 things that are certain in life. There's death, there's taxes, and there's decline in ovarian function. So it is
taxes, fucking taxes. Yeah.
I know.
That's why I love you, right?
But it is certain that our ovaries are going to fail, and our ovaries fail earlier than any of the other organs in our body. There's a sharp decline in egg reserve, and along with that sharp decline in egg reserve, that happens right around age 35 to 37. Right around the time that we have that sharp decline in egg reserve, we also see an increase in the number of chromosomal abnormalities in the egg. So as women are starting to reproduce later in life, we're starting to see more infertility, more miscarriages, and just more trouble in that arena. So I think one trend that's really hot that is one mechanism to address having babies at a later age is egg freezing. And I will say when I was a fellow and I finished my fellowship, I was a fellow at the National Institutes of Health. When I was a fellow, egg freezing had not yet been discovered. Like there had not yet been a successful live birth from freezing an egg. That came about in 2008 and I finished my training in 2007. So this was something I had never seen in fellowship, but something that as somebody who had children in her 30s and mid 30s and had some difficulty, I think I really just had an intense curiosity about it, as well as just an academic interest in, could this be one way that we can help women achieve their goals of career, achieve their goals of family, and maybe not have to be so dichotomous in choosing, do I work or do I have kids? And so I started to really think about egg freezing, and that's really become a huge trend in the field. I will say the other trend in the field is for older women to do pre-implantation genetic testing, where in addition to doing IVF and taking the eggs and the sperm and fertilizing them in the embryo, in the petri dish, rather than taking that embryo and just putting it back into the body, we now have the ability to do a biopsy, take the cells from that embryo and test all 23 pairs of chromosomes. Now, the further trend with that is to do additional testing. So there's this whole idea of polygenic risk scoring traits. It's a hot topic. It's super new. I'm not certain it's going to pan out, but that is the latest trend in the field.
Interesting. So I just read something and I was like, oh, interesting. I'm glad that I had kids I had my youngest when I was 36. So back then I was considered an old, right? They were like, oh, you have to do all the things now. And I'm like, all the things? What are you talking about? Now, living in New York City, I was not on the old. Like one of my best friends, I think she's got an 8-year-old now. And I always say 8. And she's like, no, he's like 10 now. But I keep him at 8. In my head, he's 8. My kid keeps growing and her kid is at 8 for life.
Right.
So she had kids, in her 40s. And so I always tell like my younger friends that, are trying or whatever, it is like it's not too late, not too late. Like there's a group of people that I work out with that are in their 30s or late 20s, early 30s. And they're like, it's going to be late. And I'm like, what are you talking about? You guys are like babies. What I was doing, like now you're babies. So I did just read an article. So I'm very curious what your thoughts are. And it was really about overall health. Fertility was in there, but it was really about your overall health. That what you do in, I think it was like 25 to like 35, how you treat your body then really is kind of predisposition of how you age, infertility and in health. Now, again, this was like an article that popped up, I think, on Instagram. So let's just take it for that. Let's just take it for that. But I thought it was interesting. And I also was like, wait, I'm really healthy now. But those years, I don't know that I was like super healthy, like 25 to 30, I definitely was. I was New York City partying. Like I 100% know that I was not healthy then. Then I did have kids and I was more healthy. But during pregnancy, I was probably the least healthy, which is terrible because I'm like all about health and, foods. I gained 65 pounds with each of my kids. I was a giant monster. They called me Shrek at my office because I was like 208. I was huge.
Oh my God.
You can imagine it, right? I was a giant person. I stretched really well. But so thinking about that, I was like, that's so interesting. And is it really true? And I was literally read it 2 days ago and I was like, oh, I have Eve on. I'm going to ask her this.
Yeah. I mean, I will say, show me the data behind it. And I think that's my overarching theme is I don't know that we have data to support that. I think for sure we can say that health habits matter. We know from a longevity standpoint that a lot of it is really genetic and you can modify your genetics in a way that you can have a negative impact on them. But I'm not sure how much you can outsmart a lot of your genetics. I think it's a field that's constantly evolving and we just don't know. But I do not think that specific window of time from 25 to 35 is so foundational for the rest of your life. I think it's probably the cumulative effect of a lifelong of health habits.
Okay, I like that. I'm going with that. You heard it here first. Okay, so the other question I have is for like a listener that is, I had friends that went through fertility. I was very, very fortunate that getting pregnant was not an issue. It was then birthing the child that didn't want to come out that I, had more complications. But if someone's trying to have a baby, and I was like, and I still am like the most impatient person. That's one of the things I have to work on. So I always thank God, like, thank you, because I would have been a fucking wreck. Like it took me, I'm not going to even tell because anyone that's listening to his end is having trouble. They're going to be giving me the finger. And so I'm not going to even tell how long it took. But I had friends that like, a couple months, they were, couldn't get pregnant or they had a miscarriage. And it was like, no, we have to wait a whole year. Is that still the case? Like when people can start fertility, if you can take us through that a little bit.
The data behind that comes really from the Netherlands, where they started tracking women who stopped birth control pills, and they timed to see how long it took most couples to get pregnant. And so, interestingly, about 80% of couples will be pregnant within 6 months of trying, and then 90% of couples will be pregnant within a year. So if you look at that, what do you gain between 6 months and a year? You gain 10%. And so we define infertility as the inability to conceive after a year. But I think it's really reasonable for somebody who's been trying to conceive for 6 months to seek assistance if they have not yet conceived.
Okay, that makes sense. Another, I love this. I'm like, so many questions. I'm like, this is fun. Okay. So another question that I have, because I was, and I still am, like really in tune to my body. So I always would say, like, people would be like, how, like, and literally it was like the first time, like, I'd be like, I'm ovulating, but I knew, and I literally, as I got older, so I could feel in my ovaries what ovary it was, I would get this twinge and I would know I was ovulating. And then as I got older, that twinge moved up my body. It was crazy. And doctors would be like, okay, crazy. And I'm like, no, I'm telling you, now it's under my armpit. For years, like in perimenopause, it was under whatever ovary it was in my armpit. I would get this weird feeling and I was ovulating. Then it went to one of my boobs and now it's gone. But I still, and I'm like, I know it's in there somewhere. I can't get it, right?
There's actually a name for that pain.
Is it? What is it?
Mittelschmerz. Mittelschmerz.
Okay. Mittelschmerz?
It's an actual scientific term. It is Mittelschmerz.
So I've been aware of my Mittelschmerz all these years. Did I use that correctly?
Yes.
Wait, that is hilarious. Mittelschmerz. Who came up with that?
Great
Schmerz?
name. I think it's German, maybe? I don't know. It's a great name.
That is actually maybe my new favorite word, Mittelschmerz. Okay. I was very aware of my Mittelschmerz. I'm just going to start throwing that out there and seeing what people do. Mittelschmerz. Okay. Because there's so many people in my world that were like, okay, you're insane. But even when I was little, like I could feel if my heart skipped a beat, I could feel if it fluttered. Like I know my body so well, which is wonderful, but then also somewhat annoying. I mean, I'm very lucky that I'm healthy.
I think women are insanely intuitive, and I tell my patients that all the time. I can't tell you how often I go into a room to see an OB or an early pregnancy patient, and she just gives me a look and says, I know I've lost the baby. And I ask about bleeding, and I ask about leakage of fluid, and I ask about all sorts of things, and she denies it. And she said, I just know in my heart it's not there. And sure enough, I would say 9 times out of 10, these women are correct. Yeah. And so I think that there is something to that intuition that we just know.
Yeah, no, and I love that. And so, but do you think it helped me get pregnant better because I knew my ovulation? And that's why some people, obviously there is genetic stuff why people get, where it's harder. But because I was like, okay, I'm ovulating. So I knew like, okay, we need to have sex now, or we need we need to wait or whatever.
Absolutely. Okay. I mean, there's a narrow window in a woman's menstrual cycle where conception can actually occur. So I think step one, and I always tell patients, step one is understand the rhythms of your body and understand when you're ovulating. Because if you have intercourse not when you're ovulating, you probably won't get pregnant. I mean, right. it's what people who oppose contraception, they use the natural cycles and they avoid certain windows of having intercourse because it's well known if you time it properly, then you have a really high likelihood of getting pregnant.
Yeah. And now that everyone will know how I always had sex, I did the pullout method because birth control bothered me. And, anyone that's young, it's not always the best. I mean, my sisters
do not recommend it.
No, right? Exactly. You're like, oh my God. So many people were like, you're insane. And especially like after that, like 40s where everyone would have that oops baby. My sister was like, you're having the oops baby. And I was like, no, because I know my body. Like I'm telling you, I know when I'm ovulating. So I am really good at this whole pullout method. But yes, like would I tell my daughter, hey, you should do that? Now, she's not having sex. I know that. So like, I'm sorry, anyone that knows her is like, what the hell? No, she's not having sex. She's a child still. But like, I knew my body so well that I knew that was okay. And let me preface that I was on birth control and it really bothered me. Like it really messed me up that I was like, that wasn't worth it for me. So I did use like a diaphragm, like an old lady that was left at one of the babysitter's house on their counter. That was like, that's a funny story. Yeah. When I was a nanny, I was like, oh my God, I'm so sorry. I think I left my diaphragm on your counter. They were like, oh my God. They thought it was hilarious. They're like, you use a diaphragm? I was like, yes, I'm in college and I use a diaphragm because birth control bothers me. A little TMI there, but that's
I
to be
love
expected.
it. I've fitted people for diaphragms, but I've never tried one.
Yeah, it was awkward and weird. I mean, it really actually was pretty annoying, but the side effects I had with, and I'm not going to even, because that's TMI, what happened to me with the birth control was just, I'll tell you off. Yeah, that was not fun. So does the data support that women that are on birth control for long periods of time have a harder time getting pregnant?
It doesn't. The
Interesting.
only way that it supports that is if you're on birth control for a long period of time. By definition, you're older when you start to try to get pregnant. So age is everything in the field of infertility. I always say age is queen. That's really the number one determinant of how likely you are to conceive is how old are you.
Interesting. So the other thing that I think is like, one of the reasons why I loved talking with you is because you're so frank and so open. And I know like throughout my years of having, doctors, there's times where a doctor doesn't listen to me and it angers me. It really angers me. And that's why I actually went really into the naturopath homeopathy side, because I was like, okay, you're listening to me and I feel good because as I said, I'm so in tune to my body. And when a doctor would dismiss me, I was like, wait a second. No, I'm telling you this. Like, this is not, I shouldn't be dismissed. You can give me the data, but I'm telling you that can we like have a conversation about it? So can you take us through like how when, a patient comes in, what you do and how you run your practice? Because I want people to listen to someone that is a thoughtful practitioner and not, there's someone for everyone, but sometimes like women, we sometimes go through the suffering because we're like, well, we don't know. And that person knows, but in your heart, this doctor's not listening to you and it doesn't feel good. So can you take us through kind of when someone comes into you, how you handle their case? And I know it's case by case. So maybe think of someone in your head, but don't.
Yeah, it's definitely case by case, but I think that there are absolutely patterns that we look for. So we get really into the weeds. I actually think it's amazing that I can meet someone and within 5 minutes we're talking about sex, positions they have sex, frequency of sex, making sure that they're using the right orifice. You'd be amazed. But in all seriousness, I always start by just getting to know somebody. Who are they? What do they do for a living? What are some of their hobbies and interests? What name do they like to be called? I can't tell you how many Elizabeths I have that all have different names, from Beth to Lizzie to Bonnie. And I really like people to be called by the name that they want to be called. I think that's really important to me. But once I've gotten past that initial icebreaker, let's get to know each other, then I always dive into puberty. How old was somebody when they got breast buds? How old were you when you got your period? What is the cyclicity of your period? Their menstrual cycles are a vital sign. You can tell a lot about a woman and a woman's health based on her menstrual cycles. How many days does bleeding last? How many days from day one of a period to day one of the next period? We have a very specific definition of day one, and it's full flow bleeding before 12 noon.
Okay.
So then with that in mind, we ask about things like spotting. Are you having any spotting around the time of your period? Because that can indicate some hormone imbalances.
Right.
So we dive really into the weeds. I mean, I ask people how often they change a tampon. Like, how often are you, if you wear pads, how often are you changing a pad? Are you getting up in the middle of the night? Are you leaking through your clothes? Do you have pain with your periods? Do you have pain with sex? Do you have pain at any other points in time? I really dive into menstrual health, how many days people bleed for. What color is the blood? Is it clotted? I mean, we really,
Yeah.
I think of myself as a detective because all of those signs and symptoms can be indicators of some other health issues that may be affecting their fertility. So I ask about next after their gynecologic history, we talk about sexual health. Have they ever had a sexually transmitted infection? If so, when was it diagnosed? How long do they think they had it before it was diagnosed? I ask about HPV. I ask about pap smears. I ask about everything and anything relating to somebody's gynecologic health. Then move on and just talk about their general health. Are they on medical health? Are they on medications? Do they have any diseases? Have they had surgery? What types of surgery? And then we talk a lot about family history, about their parents' fertility history, their siblings, if they have siblings. If they don't have siblings, why don't they have siblings? Was there infertility? I ask about miscarriages, stillbirths, genetic diseases in the family. I ask about health habits. We spend a lot of time talking about diet, exercise, what types of exercise, how often, how intense, any dietary restrictions, things that people follow or don't follow. We talk about weight, which is uncomfortable for many people. We talk about weight. We talk about if they are overweight or obese. Have they always been that way? When did that come on? How easy is it for them to gain or lose weight? What techniques have they tried to lose weight in the past? We talk a lot about substance use. I'm amazed at how much cannabis there is and how people are just so casual about it. We talk about smoking. We talk about alcohol. I'm also amazed by how much alcohol people drink. And I say that, so my husband's in the beer industry. Sorry, Brad, but I tell people like really to minimize their alcohol consumption. But we really dive into the weeds. When do you drink? How many drinks? How many drinks per day? How many drinks per week? How many drinks per month? What other substances? What substances have you used in the past? It takes me about 45 minutes to take a really good, thorough history. And I think that history, very often I can tease out what the diagnosis could be based on what patients tell me. We talk about men. We talk about the partners, whether or not they're present. I love when the partners are present, but they're not always there. And I understand that. But we talk about their medical history in the same way. We also dive in deep and we talk about their erections. We talk about ejaculation. We talk about timing of intercourse, everything and anything that could be potentially impacting somebody's ability to get pregnant. And then after all that, I formulate some ideas in my mind as to what I think may be going on. We put everyone through pretty extensive diagnostic testing. We also look at things like health optimization. So we talk about diet, nutrition, exercise, all of those things. And then we run through some testing and meet back and talk about what might be happening and how to address it. And I think that's the most interesting part, because in a day where I may see 4 new patients, no 2 people are going to have the same exact thing that's happening.
Yeah, no, I love that. And thank you for taking us through, because I think it is so important. And I would assume, and tell me if I'm correct or not, but, even if someone has stopped, they, again, were like partiers in their 20s and they stopped at a certain time, but that mentally, there could be mental stuff that's blocking, and then I get into my, my unicorn kind of woohoo stuff, but like, mental stuff, I think, is so huge that it could affect so much stuff. And you don't realize when you're holding on to certain traumas, if you haven't dealt with it, like if you were a heavy drinker or a heavy drug user and you were doing that to numb something maybe from childhood, if you haven't released that, I would think that would hold things up. It
absolutely can. So all of reproduction is actually controlled by the brain, or all of ovulation is controlled by the brain. And it's this intricate dance, so to speak, that has pulsatile hormone release from one area of the brain to another area of the brain. It's kind of like a symphony of hormones. And then the other part of the brain has to receive that pulsatility, has to act, and then has to generate its own pulsatility. And it's that pulsatile release of hormones in a synchronized fashion that then travels to the ovary and looks at the egg supply and recruits one egg every month to grow within a space called a follicle. And then again, more hormones and more synchrony between the brain and the ovary that causes the release of the egg from that follicle. And so I do think, and a lot of times we can tease this out in a menstrual history. If somebody doesn't have regular cycles, then the question is why. And there are a couple different syndromes, but there's something called hypothalamic amenorrhea. And hypothalamic amenorrhea is when the brain is not generating that pulsatility. And you absolutely can see that with stress, with trauma. And so I think you're onto something there.
Yeah, that's interesting. Well, this has been awesome. I mean, I think it is great. I just have one last question. Well, I mean, I really have 1,000 questions, but we'll leave it at one question. Is if someone is like, okay, I want to have a baby by this age. So many people plan things. And we all know that it's, God, universe, whatever you believe, it's really out of our hands. So whenever it's supposed to happen, it's supposed to happen. But what can you say to someone that's like, I want to start doing it? Like, where can they change some health habits or start doing things or getting their mindset into like, okay, I want to start having a baby or I want to start trying soon. What are some habits that they can change or incorporate?
I think the first thing that anyone should do when they stop contraception or even before they stop contraception is take a prenatal vitamin. There's a known association between folic acid deficiency and something called a neural tube defect, which is where the spinal cord and or brain does not develop appropriately. And it's very preventable. And so folic acid supplementation is key. But I think that in the preconception, so what some people call the premester, in the preconception period of time, I think getting your body into a healthier place, perhaps stopping, I'm very big on whole foods and not eating foods that have artificial flavors and colors and additives and artificial sweeteners. I think getting into a space where you're eating more whole foods, you're eating more healthfully. There's a lot of debate on microplastics. I don't know the answer, but I have eliminated a lot of unnecessary plastic from my life. And I think that there probably is a relationship between microplastics and reproduction that we don't fully understand. So I think even things like changing your household to have more glass and more getting away from some of those plastics is good. I think daily exercise is great. I'm curious on your take on the weighted vest, but I tell people it's a really nice way to incorporate some strength training while you're walking the dog. Like every little bit counts. I think that really just being mindful of your body and being mindful of your menstrual cycles and either using an app to track your cycles so that you can better understand your own natural patterns. You can use an app, you can use an Oura ring, you can use your Apple Watch, you can use a thermometer to better understand what you should see as a rise in temperature post ovulation. And when you want to try to conceive, you want to time intercourse to either right before ovulation or right around the time of ovulation, but post-ovulation is less effective. So once you see that basal body temperature rise, that window has closed. And in fact, again, I'm not a huge advocate of natural cycles for birth control, but once that temperature has risen, that fertility window really has closed. And so I really encourage women in the few months before they're trying to think about what are their rhythms, what might be going on with their body. The other caveat I want to say is if your cycles are irregular or you have a medical history or your partner has a medical history that may predispose you to infertility, I think it's very reasonable to seek help sooner. That year rule is largely insurance for somebody who's ovulatory with 28-day cycles. If your cycles are more than 35 days in length, I think go right to your OBGYN or go right to a fertility specialist to try to figure out why they're 35 days in length. And my guess is they're probably not ovulating. And so I wouldn't spend a year trying to get pregnant with irregular menstrual cycles.
I love that. And I mean, I think there's so much here for people to take, and I will give you my take on weighted vests. I'm not against them, but I weight train. So I'm not going to go walk with a weighted vest. I go to a trainer and I work, I think, all of a sudden when I was like, what is everyone wearing? And then there's so many comedians that are like, it's like the SWAT's out going into Target. And there's actually a Chicago, comedian that I was dying because I was like, oh yes. And I've had so many of my friends being like, what brand do you use? And I'm like, I don't. And they're like, what do you mean?
But I do both. So I actually I walk to I see a trainer twice a week and I do very heavy weightlifting.
Yeah.
Very heavy for me. I just did 95-pound squats. So I'm getting there.
Yeah, that's great. Yeah.
I'm getting there and I'm working on it. But my trainer lives about a mile from my house. So I put my weighted vest on. I walk to my trainer. I do heavy weights and then I put my weighted vest back on and I walk home.
Yeah. So, and I love that. And it is funny. I think whatever people feel comfortable, but I don't think if someone doesn't want to get a weighted vest, it's like, do what you want to do. Don't jump on a trend because you're like, I don't know the reasoning. Find out the reasoning. That's one of the reasons why I started this podcast, because there's so much noise out there for us women and men as we get older and really in all of our sections of our life. You should be doing this. You shouldn't be doing this. I mean, think about how many times it was like, you should have a glass of wine before bed. And then it was like, you shouldn't. You should have the egg yolks. Now you can't. They're going to kill you. All of these things. And it's like, okay, well, what am I supposed to do? If you think about the pyramid of what we learned we should be eating in school with the grains and stuff, then it's like, that's all bad for us. I mean, it is all so much noise that I really, really am the biggest advocate of educating yourself, listening to your body and doing what feels right for you, not what's doing for your neighbor, not because someone on TikTok told you, the mouth tape. I was like, I'm going to try this and see. I hated it. And I was like, I felt like I was choking. I was like, I
don't even know what mouth tape is.
Oh, so you're not a mouth breather. Oh, I can take you all through because I'm doing a lot of stuff in the longevity space just because I've always done that, but I love to learn about that. The peptides, all these different things that people are like, what are you doing? I did stop drinking because I started going crazy. So I was like, I need to stop drinking. And that's been great. That my skin is clearer. There's just so many different things that we just need to listen to our body. And yes, you can get tips from others, but I think if we don't educate ourselves, we could sometimes run and do things, sometimes spend unnecessary money is one, and especially for people, maybe they don't have as much money or like, okay, I'm doing it. If you're not seeing a weight trainer, you don't have the time or money, or you like, I'm so weak, I don't, and you want to get a weighted vest and it feels good, go for it. But it is not something that is necessary. But if you're feeling good doing it, I'm like, that's great. But it is funny because I have so many of my friends in that world. They're like, I can't believe you don't have it. Why don't you have it? What are you hearing? And I'm like, I'm not hearing anything. I just don't want to get a weighted vest. I like walking my dogs. They pull me sometimes I have 2 giant boxers. I don't want that extra weight. I want to be light. I'm trying not to be so intense in my older years. I'm doing yoga. I'm trying to take it down. So for me, I'm like, I can do that with them. So I think that again is just in all of these worlds, if we just listen to our bodies and kind of, do what feels right for us, but educate ourselves. So, I really appreciate all of this. And tell me the word again that I like, the schmirk. What is it?
Mittelschmerz.
Mittelschmerz. Oh my God, that just makes me happy. Mittelschmerz makes me happy.
I think it's spelled Mittelschmerz.
Mittelschmerz. Oh my God, that is hilarious. I didn't know I was Mittelschmerzing all these years. So people can find you on all the podcast players, Fertility and Sterility. I said it. Remember last time I couldn't say it.
Fertility and Sterility on air.
On air, yes. And then they can also go and find you on LinkedIn, and you are on Instagram as well.
I am. I'm not on TikTok.
Okay. Yeah, I know. It's one of the, it's so hard to get all these things, but I love what you're doing. I'm so glad that we're connected, and I have so many questions, and I know you got to see patients, but we're going to we're going to continue this. So you guys, you know what to do, like, rate, review, and share. And thank you so much, Eve, for joining us and answering all my questions.
Thank you. This was really fun.
Mittelschmerz. Thank you for listening to Don't Die Curious. If this episode sparked a question, leave a review and share it with a friend. You want to connect or suggest a topic? Just look me up. I am Juliet Hahn on Instagram and LinkedIn. Until next time, stay curious and keep asking those questions. You don't know where it's going to lead you.